Hello, I'm John Seffron, a professor of practice at Indiana University School of Public Health, Bloomington. And with my colleague today, we want to discuss the 8 dimensions of public health. This webinar's objectives are to be able to explain what public health is, then to talk about how everybody's connected to the public health system, and many of us are a part of the team of public health, even though our job title might be different. And then thirdly, to specifically talk about the 8 dimensions of public health. So what is public health? Well, it's a little difficult to define because it's multidimensional. It is defense and it's also offense. Meaning by that, it is there to protect people, but it's also there to promote the public health, individuals and in communities. And it is the most important part of the healthcare system in America today to keep people well. There are some specific definitions of public health. Our Distinguished Centers for Disease Control and Prevention, based in Atlanta, Georgia, defines public health as public health is the science of protecting and improving the health of families and communities through promotion of healthy lifestyles, research for disease and injury prevention, and detection and control of infectious diseases. Certainly a mouthful, but it does hit on all of the cylinders of what public health is about. The American Public Health Association, a professional society that many of us belong to, defines public health as public health promotes and protects the health of people and the communities where they live, learn, work, and play. I really like that definition because it talks about the multidimensionality of public health. Another way of looking at public health is to say, well, what are its functions? So this is not to define public health, but to illustrate what it does. And as you see, it actively monitors health in a community and in the nation and around the world. It diagnoses and investigates, it informs, educates, and empowers. It's an important word. Not only does it give information to the public, it educates and empowers people to take action. It mobilizes, it develops policies, it enforces laws and regulations, it links to providing care, and it ensures a competent workforce, it evaluates, and it researches. That's an awful lot. So to say we're multidimensional is not by any means an overstatement. If you look at the graphic, another way of looking at it is that public health assesses. Ongoingly, we assess the level of public health in our communities. We then do policy development, all of which is designed to change what is and what should be with respect to health, and finally, assurance, to assure the public's health. To give you an example of how important public health is to the health of the nation, your community, and indeed the world, here are some of the greatest achievements of public health in the last century. So whether it's immunizations, whether it's understanding the problems of tobacco use, controlling infectious diseases, having safer or healthier foods, major advancements and thus increases in life expectancy have occurred because of public health successes of the past. One point is important here, though. The 21st century is going to be different from the 20th century. So much more emphasis will need to be placed on non-communicable diseases, as aging is a global phenomenon, and we're going to see much more emphasis on diseases like cancer, heart disease, lung disease, and the like. An important point, this graphic is a bit busy, but it's important because as you see the Public Health Agency in the center, it is connected to all parts of our community. So whether it's schools, nonprofit organizations, drug treatment centers, nursing homes, everyone is connected to and through public health. Secondly, everyone has a role to play. Everyone, whether it's citizen compliance with their medication protocol, or physicians taking care of patients, or businesses promoting and protecting the health of their employees, or parents making sure that their children have the proper immunizations. Everybody has a role to play in public health. And a third point, a breakdown in a part of this scheme can have a major impact on the entire healthcare system. So public health is interdigitated and interconnected in every way. Public health is interdisciplinary. A lot of people don't realize that. They think public health, they think about science and medicine, and that's of course there, but it also involves education and social work and law and policy and psychology, as well as science, medicine, and healthcare. Let's talk a bit about good health. Good health is a state of complete physical, social, and mental well-being, and not merely the absence of disease or infirmity. That was written 70 years ago by the World Health Organization and approved by the United Nations. And I've always liked it. There are other definitions, but I've always liked it because it makes such an important point that good health is complete physical, social, and mental well-being, and not merely the absence of disease and infirmity. I had the privilege of studying with Dr. H.S. Hoyman at the University of Illinois many years ago, and he wrote an article describing what he called the ecologic definition of health, and he added the dimension of the spiritual dimension, which we will comment on more in just a few minutes. And now with my colleague, Dr. Carrie Doherty, we want to talk about each of those 8 dimensions of public health. But before we do, please look at the graphic. It makes a very important point, and that is each of these dimensions of public health are not discrete. They overlap, and one can affect the other, and one does affect the other, as we'll talk about in just a minute. But Carrie, let's go to the first one, which is emotional, the emotional dimension of health. And I think of it as basically coping, that it's natural for a human being to have a range of emotions, and we can be anxious on one day, and we can be at peace another day, and we can be angry sometimes. But the key is someone healthy? Can they control their emotions?
No, absolutely. I think this accounts to medical health care providers, therapists. As you said, there's several careers that really embrace this dimension of emotional wellness.
And before we move on to another one, I want to make a comment here because it's so very important. Mental illness is one of the least attended to dimensions of health that we have. And it so affects other dimensions of health, and it relates to things like suicide and violence and drug abuse. So sometimes we should pay more attention to emotional health than many people might otherwise think.
I think this headline's interesting because so many times physicians ask you how you are, but they're not necessarily looking into what emotional stress is occurring in your life. I think slowly that transition is occurring, that physicians and other healthcare providers are taking a holistic approach to treating their patients. It's really clear that when emotional stress is elevated, their health outcomes are worse. So if we can manage and treat the entire patient, instead of just the illness or the injury or disease, I think those outcomes are going to improve as well.
I agree. And if we move on to financial health, many people might think, what's financial health? Is this about accounting? No, it isn't, but it's important to know that one's financial situation does relate directly to their health status. In fact, Sam Broder, who was the director of the National Cancer Institute many years ago, actually made the statement, poverty is a carcinogen. And so we have to understand that not only are we talking about making ends meet, but people have to have the financial capacity to take care of themselves.
Absolutely. Those that have financial stress show to have greater health problems. They report these greater health problems. Some of our colleagues have calculated a financial stress index, and they categorize people based upon that financial stress. 27% of people that have a high financial stress index have problems such as ulcer or digestive problems. That's compared to only 8% of people that have low financial stress. So clearly we're seeing those linkages between financial stress and your wellness.
Absolutely. And then social health. I remember a few years ago the best-selling book, Bowling Alone. But it's, in today's complex society, it's easier and easier for people to get isolated. And what we need to know is that belonging, a human being is a social animal, and having relationships is so important in one's health, not only to stay healthy, but if one is ill, how important those relationships are for a network of support. We need support systems to get through this life.
And health outcomes can spread through these social networks. They can spread in a positive way, but also in a negative way. I think we see that people who have spouses or friends that are obese are at a greater risk of being obese. But the other side of that coin is happiness spreads as well. So again, if you're creating a network of happiness, that can also grow and become infectious as well.
I agree with that. And then I mentioned earlier spiritual health, and I want to make 2 points here. Number one, when I think of spiritual health, I think about purpose. The human being, we think, may be the only animal that has some sense of our lack of immortality, that we spend much of our life trying to figure out what's life all about, what do I want to accomplish, what does it all mean. For some people, it's a faith-based situation, but for others, it's not. But it's the notion here of the belief in something greater than one's ordinary self.
And I love that when you're looking at these careers, you talked about, yes, it's clergy, and oftentimes we think about that religious, spiritual wellness, but you can also find this wellness through meditation, through yoga. I think with yoga we think of all the physical benefits, but we also know that it decreases anxiety, it decreases depression, it improves your health-related quality of life. It creates an atmosphere and a pathway to centeredness, and again, reflecting upon what's happening in our world.
And if we move on to occupational health, I want to make this point. It's not just about workplace safety, and of course that's very important, but it's about the personal satisfaction one gets with their work. I often, when I say my daily prayer, I give thanks for the fact that I ended up in public health, because I go to work every day thinking I'm making a difference, a positive difference in the lives of people.
And not only is it about us finding occupations that fill us up, but we're seeing a change in perspective here. Employers are beginning to worry about their employees being happy and well. All these perks that we see in some corporations where they're providing more vacation days. They are having a bring your pet to work day. Things that simply enhance your happiness. And economics or economists are identifying that a happier worker is a more productive worker anyway. So again, all of these things are so interconnected and they benefit all of us.
And I bet everybody listening is very familiar with the physical dimension, and that's natural. I think we know if we have a temperature or a broken leg or an ulcer, as you mentioned earlier. But I would like just to make the point that we are blessed and fortunate to live in a society where 95% of all neonates are born healthy, and then something too often goes wrong. And I want to mention the importance of physical activity. I gave an AHI Scholar lecture many years ago in St. Louis, and I looked at our cancer prevention study number 2 data, where we're following 1 million people throughout their entire life. And we looked at fruit and vegetable intake, body mass index, tobacco use, and physical activity. And I said, let's just look at physical activity and tobacco use. In our study of over 1 million people, the absolute risk of dying in midlife between age 35 and 69, if you self-reported getting some regular activity, you didn't have to win any races, but you did some physical activity and you didn't smoke, your absolute risk of dying of anything was 8%. In this couch potato smoking counterpart, it was 39%. A 5-fold increase in the risk of dying in midlife. So it would be difficult to exaggerate how important physical activity is. It's often said it's nature's best medicine.
Oh, absolutely. And like you said, we're not all going to be elite athletes. Actually, very few of us are. But the American College of Sports Medicine identified that adults should get 150 minutes of physical activity each week. And that can be small bouts of a 10-minute walk around your office. It doesn't have to be an hour of physical activity. Children, on the other hand, they should be getting about 60 minutes of physical activity a day. So running around, being children, we really want to encourage and get our parents and our educators to really enforce this physical activity.
And I love the connection between physical activity and mental health. I've never won a ribbon, but I've run the equivalent of running around the globe at the equator 2.5 times in my life.
Wow.
That's how old I am. But I never feel better any day than I do after getting out of a hot shower after doing my 5 miles on my elliptical trainer.
Absolutely.
Intellectual health. Carrie, when I think about this, I think about the fact that we often overlook the fact that each human being is unique, and everyone has some potential. And one person it might be to be artistic, and another person it might be to dance, another person might be to be an athlete. But I think the concept of intellectual health means everybody trying to achieve what they can intellectually and being committed to lifelong learning.
And some of that intellectual wellness is often centered around cultural awareness. Again, learning about what you can about the people around you, both locally and around the world, enriching yourself. And again, that can be the most rigorous of academic pursuits, or it can be learning about a recreational hobby that simply fills you up and makes you happy.
And I'd just like to add, don't forget about the importance of play.
Yeah.
I feel that you should. I just gave a commencement speech at a university a couple of weeks ago, and I made the point that you need to find the play in your work as well and enjoy it. And for some, that might be having an adult coloring book. Environmental health. How important is that? Extremely important. You know, it's interesting, my lifetime work in cancer, we know that cancer is a genetic disease, but 80% of all human cancers are caused by the environment that people are in. In fact, I think we haven't stressed that enough. For example, let me give you a very concrete example, just published. One state, Ohio, one county, Cuyahoga County, one city, Cleveland. In Hoe, which is one neighborhood, the life expectancy of men is 64. 8 miles away in Lyndhurst, life expectancy for a male is 88. Hard to believe. In Hoe, the average family income is $18,500 a year. In Lyndhurst, it's $63,000 a year. So we have to understand that disparities are increasing. They've increased over the last 50 years. And so the gap between the lowest 10% in terms of economic power and the highest 10 is getting wider.
It's access to healthy homes, it's access to park, good medical facilities, good food options. All of those things aid in our environment, providing health and wellness to ourselves. I was going to provide an example in Washington, D.C., a similar statistic. 2 adjacent communities, life expectancy was different by 9 years. So again, things that happen in relatively close communities can really dramatically affect the health and wellness of that community.
And then I think, just to conclude on this, and what is so inspiring to me, but also it's very challenging to understand, is the interconnectivity of all these dimensions and how one can affect the other. And we have to pay attention. We have to be holistic. We have to think about wellness. And Francis Thompson, many decades ago, wrote a poem called Mistress of Vision, in which he said, "All things by immortal power, near or far, hiddenly to each other linked are, that thou canst not stir a flower without troubling of a star." And it's wonderful to contemplate just how important that is, that you really can't stir a flower without troubling of a star. Our health is a wonderful thing, but it needs to be nurtured.
Absolutely. And thank you so much for joining us today on discussing the 8 dimensions of public health.
Well, it's my privilege to do it, and I was thinking the other day, public health is really all about change, because we're a group of people that say, the human being is the only animal that both laughs and cries, because that's somehow because we know the difference between what is and ought to be. And people in public health work every day to change what is into what could be. Public health is all about change in policy, change in practices, and change in behavior. And we have to get these changes effected if we are to become the healthiest nation in the world, which we can, but we're not now.
Absolutely. Thank you.
Thank you.